I'm so thrilled to be joined by Kalpana Kochhar with the Gates Foundation. Kalpana directs policy and finance there. And this is a conversation I would love to have just by the two of us over a glass of wine, and we get to do it in front of all of you, and you get to be part of it. So welcome. Um, Kalpana, I guess I have a lot of excitement coming into Sevilla. I got some sense of it last night in our opening reception. And I think some of that excitement is people see we've come off of 5 months now or so of aid cuts in the US, of course, but in the UK, that's off the back of years of aid cuts now coming from many global north countries in Europe. And so there was a sense of scarcity of challenge. But here in Sevilla, there's an opportunity maybe to reimagine a new era. And so I get this idea that we're moving into an era of development finance. We're going to use innovative financial tools to leverage the capital markets, to borrow more money, to encourage private investment. It's all very exciting. But I do have a concern about health in particular, and where health fits into that. So much of what the Gates Foundation does is health.
Yeah.
You're just coming off of the Gavi replenishment in Brussels. And, when I think about health, it's easy for me to think of how you make money on a port or a road or a solar farm. It's a lot harder on health. And I worry that in this conversation about development finance, we might lose the focus on health. So I just wanted to begin there to get your take on where does health fit in to this new era of development finance?
Yeah. Raj, maybe before I address your question directly, just worth a reminder, actually, as you started out, it's only been 10 years. 2015, was the year we set the SDGs, the year we made the Paris Agreement, the year we had the Addis Agenda, 10 years only. And at one level, you can say things have really changed a lot. But at another level, I think it's worth reminding ourselves that something brought the world together 10 years ago to make all these pledges and actions. So how much of that can we now try to revive, even though we know things have changed a lot in these past 10 years, which by itself is also just worth wondering about, right? A decade. Anyway, coming to your question on health, yes, I do want to say the foundation put out a paper, I guess it was about 18 months ago, talking about a fit-for-purpose financing framework where we said there are going to be some investments that have massive societal returns, health, education to some degree, social protection, basically people-centered investments that have huge societal returns, but maybe not, big financial returns. And so we had sort of said, when you have scarcity of money and you have all these competing and really important investments ranging from health all the way to climate mitigation, can we get smart about how we allocate finance according to sort of economic first principles, risk and return profiles? And in that conversation, yes, health may not be a stage moment or a ribbon cutting moment, but it is fundamental. We know that. We know when countries have had periods of bad health, you have, your basic foundation, which is human capital, doesn't accumulate and to the quality and quantity that's needed. So for us, I think we're very clear that the cheapest money, most concessional money, grant financing and very concessional loans should be allocated to those investments that give you this massive societal return, but not necessarily a financial return.
Those would be things like vaccines, like Gavi, right? Which is mostly going to be concessional money.
Right.
And the economic theory there is, look, if people are healthier, they're going to be more productive.
Right.
They're going to earn more, produce more. And ultimately, through taxation, governments will actually have more revenue.
Right.
And ultimately could pay back a loan if there was a loan component of health. But it's a longer road to get there than something like a toll road or a bridge or
a bridge or a port.
Yeah. And so I guess the challenge is, are there opportunities beyond concessional, beyond grant financing? Is there a place to think about health within this development finance architecture, and what would that be?
I mean, you touched on it, the innovation part, the vaccine development part. I mean, remember what one of the things that Gavi brings is, not only access to sort of life-saving products, but really this market shaping, right? It was not long ago, I think something like 90% of all the R&D that was being done in health was focused on sort of 10% of the population. And so I think Gavi that and other such mechanisms have been also to crowd in money. So it's not just, I mean, it's true, I said something about allocating the most concessional money to health, but there are ways in which you can use that money to crowd in private sector money, like we've done in vaccine development.
Well, and I think that was one of the big lessons coming out of the pandemic, the COVID pandemic, was countries that didn't get easy access to vaccines said, we don't want to go through this again. We want to have local manufacturing of PPE,
Exactly.
of treatments, of vaccines.
Right.
That movement is happening, and presumably that is investable, right? That
is
could fit in
investable.
this development finance architecture.
Indeed, that is investable. And we're starting to see some of that happening in Africa, but maybe just it's worth reminding ourselves that in countries that are somewhat further up the income chain, let's say India, for one, where I'm from, now you have a very thriving vaccine development industry there, funded, maybe seed funded with philanthropic money, but now almost fully privately funded.
Yeah, and so you can generate real returns. You
Right.
can create opportunities for private investment, and presumably there will be investment opportunities like that throughout sub-Saharan Africa. I know, for example, in Nigeria, Minister
Right.
Pate is doing a lot of work to try to develop local manufacturing of bed nets and things like that,
Exactly.
instead of having them shipped in from overseas. So while much of health funding might have to be concessional, ultimately buying a vaccine and getting it in the arm of a child who needs it, there's lots of parts of that overall industry that could be investable, right?
Absolutely.
Yeah,
And also, just to point out, some of those, are ideally stepping stones to a higher technology, but at the moment, they're actually something that is, well within the capability and capacity set of many countries.
Yeah, there was 10 years ago, you mentioned 10 years ago, we had this Otis third financing conference that we're now at the fourth here in Sevilla. And one of the key themes that came out was this idea of country ownership, that countries are supposed to be in the lead. I guess I wonder, from your perspective, what does that mean now for health?
Yeah.
Because you're obviously thinking about this at a global level, but ultimately, much of this really happens at the country level, right? It's about their health system, their health strategy. So how do these things connect today?
Look, I wanted to say in any sort of adversity, there's a silver lining. And so if there is a silver lining in this situation that we're facing now, it is to really say that, to shine the light back on countries themselves, to say they really always have to be in the driving seat, whether it's health or any other investment, right? But I think in part, now is the time, and we're seeing it actually. You mentioned Minister Pate in Nigeria, very much taking charge of, okay, what is it that we need? What are our plans, annual plans that we need, both at the county level and at the province level, and back at the federal level, and then turning to donors, because you still need the multilateral system, right? Turning to donors and asking, do you see yourselves as part of this plan? And then inviting them. So I think that's the kind of movement that needs to start happening in countries across sectors, but in particular in health. And I think in some ways, as I said, the silver lining here is it has shown countries where the gaps are in the investments that they themselves need to make. Again, not without multilateral support, we're fully behind that, but really taking charge of the plan.
If you look at Gavi has graduated a number of countries
Exactly.
who originally needed that subsidy, that support to bring in vaccines and help purchase them at a lower price and get them in the arms of children, but now are doing it on their own.
Yeah, and you can still be part of that procurement arrangement, but you pay for it yourselves.
Yeah, and I guess the challenge, of course, what do you do with the countries that are far behind? I think of a program like PEPFAR, where you have a sudden cutoff, sudden disruption because of the aid cuts in the United States. In theory, countries should be able to pick up and provide treatments for their population, but the suddenness of it makes it very tough. When you look at the landscape of countries you work with in the Gates Foundation, presumably there are many that would not be able to take a country-first, completely country-owned strategy for quite some time.
Not yet, yes. But I think that's when that's when there are other parts. Remember, the other parts of the agenda that we set for ourselves that these countries also need to focus on, not just for health. And you mentioned it a few minutes ago, raising their own revenues. There's tons of work by places like the IMF and others that show that they're far below the potential, even before we get to growth. The revenue that they can collect now based on their economies now. And there's a multitude of reasons for it, including state capacity. And I think these are gains that can be made, including through digital tools and others, but they can be made fairly quickly, not saying months, but certainly not years. And that could also start helping finance. And by the way, it has all kinds of positive knock-on effects. When countries raise their own revenues, they look better to investors even.
In some ways, they are raising their own revenues now in the least efficient way, which is by
Exactly.
charging patients. Think of so many of the countries where you work, more than half of the healthcare cost is borne by the patient out of pocket in a moment of an emergency, showing up to a hospital or a clinic, and they have to find the cash, both for the transportation and to pay for something. That's the least efficient way to run a
Most
health system.
regressive.
Right. The poorest people are stuck.
Right.
And it's often simple things like getting transportation that are the reasons they can't get access. Whereas if they're able to increase tax collection, it's a fairer system and you can invest more in prevention, things like vaccines.
Exactly. And no, so when I said domestic revenues, I'm really being very clear, if I wasn't before, that it should be through the taxation system, which, by the way, should be built on equity and fairness, and accountability back from the government. But yes, what's happening now, the forced way of either out-of-pocket expenses or, actually worse, foregoing treatment, is truly very regressive.
Yeah, it's regressive. It leads to, unnecessary death, unnecessary disability, and it's the most expensive way to do healthcare. So what is the best way? I mean, when you think of maybe some of the exemplar countries out there, what is their smart strategy, given that they have very limited resources? And it's worth people listening to this to remember, in the rich world, many countries, the U.S. is maybe an outlier, we spend so much, but think of many countries in Europe are spending several $1,000s a year per person on healthcare. And a lot of the countries where the Gates Foundation is working, they're spending 100, 200, a few $100. I mean, it's not even close to these levels. So what should countries like that with very limited resources be doing? What's the smart strategy that in this era of new development finance?
Yeah. I'm going to come back to saying, I think from a country point of view, really saying if there's grant money available or if there's cheap money available, let's focus it, whether it's from IDA or from Gavi or from other concessional pools of money, really to say, let's prioritize those investments where private money will not go right now. And I think we should that should be like a mantra that we keep repeating to countries and to donors. What else to do? I mean, I think raising revenues. Now, it's easy to say raise revenues. It's less easy to say allocate it to health because they've got so many priorities, right? So I think it's really focusing on grant money, but also we need to make the case more strongly, I think, to governments that the investment that they make in health today is going to have a payoff that's really kind of immeasurable. And yes, it may not buy you the stage moment, but it'll buy you a lot more. It's a tough argument to make, especially if you're looking at short political cycles. But I think as advocates and as people supporting advocacy, that's one of the biggest messages that we need to make, that this is the investment that's going to basically get your country out of where it is now.
Yeah, and I think that there's a lot of evidence to support that idea, right? It's not just a narrative, it's real.
It is real.
The problem, as you say, is both, can you connect that to the political reality, the short-term nature of elections, and do people get elected on it? And then ultimately, can you connect it to this international financial architecture? So what do you want to see out of these conversations in Sevilla when it comes to this? Very limited concessional finance in the world, getting more limited. We experienced that in Gavi, where you had countries like the U.S. pull out completely. So what should this new architecture look like when it comes to health?
Yeah, I keep coming back to saying, let's be very, very clear on where it is that we want to allocate, prioritize the kind of money that will go for health, and also be very realistic. In the previous conversation, we talked a little bit about, crowding in private money and so on. I think obviously we need to continue to work in that space, and the Gates Foundation is committed to doing that. But I think we need to be very realistic about using, what sectors is it going to come into? What countries is it going to come into? What does it take? How much of this, scarce money do you want to put in to drive some amount of blending, which may or may not scale? You might get a deal here and a deal there, and is that the kind of work that you want to do? So I think really being kind of brutally honest about allocating finance in the most sensible way. And I don't know what I don't think we're there yet. I think there's still a lot of swirl around. You'll see it also in in the advice that a lot of countries are getting. I think someone I saw on LinkedIn recently said something about, why is Sao Tome and Principe making a plan for climate mitigation? So it's really also saying, are we achieving the global goals in the most efficient way by focus, but in the way that we're doing now, or should we be focusing on where the biggest gaps are in countries, what the investments that they can make to close those gaps? So the countries where poverty is still high, the fastest progress you're going to make to SDGs is to close the poverty gap. To get those countries to mitigate whatever it is that they're emitting is going to get you nowhere with respect to climate.
Yeah, that's a really interesting point. We talked earlier about country ownership, but if you take the perspective of the country, especially small countries, you mentioned Sao Tome and Principe, small countries, they have to look at conversations like the ones happening in Sevilla. They look at what's happening in global north capitals, and they say, well, we have to market ourselves to where the trends are. And if the trend is climate finance, even if we are not emitters, even if we are suffering from energy poverty,
where the money is,
go to where the money is. Suddenly we'll have to create a plan around that. And then perversely, you end up with this very scarce concessional finance funding the wrong thing in the wrong place.
Yeah.
And I can easily see how that happens when you're at this global level. If countries can't say, and we know they're example countries, especially bigger economies, but they can say, no, we have a plan. Donors, you have to come fund our plan, not the other way around.
Exactly. And I think we've been shy about that narrative because, how can we say climate mitigation is not important? That's not what we're saying. That's not at all what we're saying. We're saying it is important. It's just, and therefore make the investments where the payoff is going to be the highest.
Yeah, but we have the truth of the global institutions. There's many of them, many MDBs, many DFIs. There's the Gavis and global funds of the world. There's so many institutions and actors, each pushing on their own issue. And it sounds like what you're calling for is we need to take a step back in this new era of very scarce resources. And some organizations, some institutions will have to decide, we're not going to focus on that geography. That's not the right place for us. Or we went to this very exciting sounding blended finance instrument, but let's not use scarce resources to de-risk a private investment there. It's just the wrong way to use that money.
Exactly. Raj, you put it well. I mean, if you also just look at the data on blended finance, since we're talking about that, there's a reason most of it goes into energy sector and then the infrastructure sector. There's a reason for that. It's revealed preference in some ways, right?
Well, there's a return. There's an obvious immediate return. As we were talking at the beginning of the conversation, if you set up a solar farm, you can find a way to finance that. People will pay for electricity.
Right.
So it's a much easier investment to make, and they need to be made.
Exactly. So allocate money there and free up the resources. I think one point that you're bringing up is probably partly also what we need to do as a development community is we've having these conversations in settings like this, which is critically important. But I think this drilling down on what types of investments countries should be making, that's their prerogative, but also how should they be financed? I think those conversations need also to be happening at the country level. And that's probably the next frontier that we need to be pushing on.
So let me just, as we wrap up, think about where we're headed from here. We talked about 10 years. In some ways, it's not a lot of time.
There's not.
But, your ultimate boss, Bill Gates, famously has said, we overestimate what we can do in 1 year, but we underestimate what's possible in 10.
Right.
And you can look at this new era of innovation, of AI, of course, but innovation across many sectors, particularly in health. The innovation happening in finance that we're talking about here in Sevilla. What would success look like for you as you look forward 5-10 years?
Yeah.
how would we look back on this moment in Sevilla and say, okay, we set something up right. We set up a system, we made a tweak and a change in the architecture that's going to get us going in the right direction. What is that message you have to the attendees here in Sevilla?
Yeah. Can tell you what we shouldn't be doing, right? I mean, I think, and Bill, I just want to put that out there because he's been talking so much about the fact that we could have actually the first year where gains are being reversed. That should not be allowed to continue. That would be a failure on so many levels. But what would success look like? I think, number one, accelerating the transition to self-reliance. I really think this is when we start. We should maybe even start with that, saying many countries have actually, since the last time we had this conversation 10 years ago, transitioned. As you pointed out, many of them have graduated, whatever you want to call it. That should, so I really focused on accelerating that transition for the other countries, recognizing that some will take longer for all kinds of reasons. Putting people first, really recognizing that without human capital development, you're not going to get anywhere. And I know we talk about jobs being paramount and employment being paramount and growth being paramount. Who's going to drive that if you don't have healthy, productive human capital? And then, the third thing basically is just, as I've been saying, really socializing and beginning to use this sort of fit-for-purpose financing framework that I've been talking about.
Yeah, the danger in our space is fads can take over. Human capital was a fad for a while. People really were talking about it. And now, because of the moment, because of the scarcity, because of the climate crisis, it's easy to lose sight of some of the things that we need to continue investing in.
Right.
And I think that's an important message. I'm glad you're bringing it here to this stage.
But even if, as you mentioned, AI, even technology, who's going to drive the benefits of those technology unless you have people there who are behind that, and people who are healthy, trained.
And what kind of world do we want to live in? A world where we have autonomous vehicles, where we have super intelligence, and there's still people who can't get access to basic medicine?
Yeah.
It doesn't make sense in this day and age. And we have every tool available, even in this moment of some scarcity in aid budgets, every tool available to address it.
Yeah. And I'm proud to say the foundation continues to, I'm happy. I think Goalkeepers 2 years ago went through all the, very, very inexpensive innovations to significantly affect maternal and infant mortality. We're talking $1, $2, maybe $10. We have those. So even with the limited amount of money, you can drive progress if you're really focused on it.
Well, it's been a thrill to get to have this conversation with you. And
Thank you.
I know it's one that's going to continue throughout the days here in Sevilla. Nice to see you, Kalpana.
Thank you very much.